If you look at the numbers behind incontinence in women, it's hard to believe just how big an issue it is. Incontinence affects more women than diabetes, breast cancer, and heart disease, but it doesn't get nearly the attention it deserves. That's why the National Association for Continence has created the We Count campaign to help you realize that this isn't just a you problem, it's an us problem. There are treatments available right now that can make a real difference in your life, and we invite you to take action today. Visit nafc.org/we-count for essential facts, insights, and resources on stress and urge incontinence, overactive bladder, menopause-related leakage, and more. That's nafc.org/we-count to learn more and discover that there truly is strength in numbers.
Welcome to Life Without Leaks, a podcast by the National Association for Continence. NAFC is America's leading advocate for people with bladder and bowel conditions, with resources, connections to doctors, and a welcoming community of patients, physicians, and caregivers, all available at nafc.org. If you're living with incontinence, there's a good chance that one of your biggest concerns is how to pay for incontinence products. They can be costly, especially for people living on fixed incomes or with low incomes. Depending on the severity of your condition, the type of product you prefer, and the number of products you use, you can see costs anywhere from $50 to $400 a month to cover your supplies. We don't need to tell you how quickly that can add up. At best, it can eat into your savings, and at worst, it can force you to choose between your products and other essentials like food and medicine. It should come as no surprise, then, that one of the questions we hear all the time at the NAFC is, will Medicare or Medicaid cover my incontinence supplies? First, let's start with a quick refresher on the difference between Medicare and Medicaid. Both of these are government-run programs that provide health coverage, but there are big differences between the two. Medicare is a federal program that offers health coverage to people over the age of 65 or those who are under 65 but have a disability. If you've paid Medicare taxes on your earnings during your working years, you're eligible. It's a great value. In fact, it's typically the most highly rated service the government provides. But keep in mind there are also premiums that are typically charged for parts of Medicare coverage. Medicaid, on the other hand, is a federal and state-run program for people and families with lower incomes, seniors, and people with disabilities. The plan is based more on income level regardless of your age. The bad news when it comes to Medicare is that it doesn't generally cover absorbent products, but it may cover non-absorbent products like catheters and related items. In order to get coverage for these, you'll need a physician's order or a prescription stating that it's necessary to treat your condition. One thing to keep in mind, though, is that there are lots of people who have Medicare Advantage plans, which are run by private insurance companies. These plans tend to offer the same benefits as Medicare, but they may have some additional benefits too. Our recommendation is that if you have a Medicare Advantage plan, it's a good idea to call your provider and see exactly what's covered. Now, if you have Medicaid, you'll want to check with your state-provided plan to see what they cover. The good news is that the majority of states do offer some level of coverage for incontinence products, which may include underpads, adult briefs, bladder control pads, male guards, booster pads, and protective underwear. To get these covered, though, your doctor will have to complete paperwork that shows the products are medically necessary, which is all the more reason to see a healthcare provider about your symptoms rather than just trying to manage on your own. Of course, every state Medicaid plan is different, so it's important to learn what your state plan covers and to get a sense of the paperwork and process needed to get your claim approved. But what do you do if you don't have coverage? Fortunately, there are other ways you can save. If you're a veteran, you might qualify for benefits through the Department of Veterans Affairs. Contact a local office to learn more about VA benefits, if you qualify, and how to go about getting coverage. Another avenue to consider is a diaper bank. These are organizations that exist specifically to provide free diapers to people in need. Some diaper banks may distribute products through other local organizations, or they may have their own location where you can pick them up in person. Either way, the best way to find out if there's one near you is to do an online search. A great place to start is just by going to 211.org. You could even just dial 211 to ask for help. Buying in bulk is another great way to save. It can be a heck of a lot cheaper than buying smaller packs more frequently, and it's certainly more convenient. Lots of online retailers offer bulk options, and they're delivered straight to your door in discreet packaging. And while you're at it, don't forget to look for coupons. The world of incontinence supplies is pretty competitive, and retailers frequently use coupons as a way to grow their business. You can look in the newspaper and weekly flyers or do an online search for adult diaper coupons. Finally, it's a good idea to keep all your receipts for your non-reimbursed medical expenses, including your incontinence supplies. You may be able to write off these costs on your year-end taxes and lower your taxable income. If you have any hints or tips that have helped you save on your incontinence products, share them with the rest of the world. Visit nafc.org and leave your advice on our message board or on our blog, because there are literally millions of people out there who can benefit from it. Life Without Leaks has been brought to you by the National Association for Continence. Our music is Rainbows by Kevin MacLeod. More information about NAFC is available online at nafc.org.